She doesn't really go too much into like ICP, so I wouldn't go into like too much detail of knowing it when you're studying it. I'm trying to like get all of this, but there is primary injury, there is secondary injury. Primary is just it at first happens at the injury, and then secondary happens because of an injury, like later on. But there are factors that can influence your ICP, which I think are important. So your factors that can influence your ICP under normal circumstances are changes in arterial pressure, venous pressure, your intra-abdominal and intrathoracic pressure, your posture, your temp, and your blood gases, especially your carbon dioxide. So throw this in here. Your normal ICP ranges from 5 to 15. Anything like greater than 20 is abnormal, and that needs to be treated. I don't think you need to really know for forward anything about like the CPP or the MAP or like how to calculate any of it. For ICP, she's kind of more bigger on like the clinical manifestations. And kind of maybe like the factors that happen with it. So like your intra-abdominal and thoracic pressure, that's like vomiting or bearing down. Your posture, you always want to like align the patient's body correctly. And keep them at 30 degrees. So their head of the bed should be always like at 30 degrees with your head in like a neutral position. Your temperature is like hyperthermia. These are all things that can cause your increase in ICP. And then your blood gases, if you're hypoxic or your CO2 levels go up. There are different stages to your ICP. Again, I don't think she's really big on them. I didn't know them. I think the only thing that like is important is that if it gets to like stage 4, that's just when the herniation occurs. Again, she's not too specific. You don't have to know exactly like this is stage 4. This is just important because this is when your brain herniation occurs. And then your clinical manifestations. All right, so your clinical manifestations, you're obviously going to have a change in LOC. You're going to have a change in vital signs. And these are related to an increased pressure on the thalamus, hypothalamus, pons, medulla. But the only thing that's important about this one is your Cushing's triad. I think that's the biggest sign that you guys should all really know. So your Cushing's triad is your systolic hypertension and a widening pulse pressure, bradycardia with full and bounding pulses, and irregular respirations. So I would definitely remember this one. If your patient like comes in with normal vital signs, whatever, and then all of a sudden their blood pressure goes up, their can't even think of it, pulse goes down, and then their respirations go down. That's a huge sign. But this Cushing's triad is a late sign. So this doesn't appear until your ICP's been up for a while. And it is a medical emergency. This is a sign of your brainstem compression and it's impeding death. She's really big on, I think this time, cranial nerves. So every time something affected a cranial nerve, I kind of just focused on this. Your ocular signs for this one is going to be compression of the CNN3. So cranial nerve 3, that's your ocular motor nerve. And this results in dilation of the pupil on the same side as a mass. In this situation, this is important for you to know. A fixed unilateral dilated pupil is considered a neurological emergency. The last thing you should know, I think, for your clinical manifestations are the postures. You have decorticate posture. I feel like you might have, I would know the difference between these two for sure. Decorticate postures, like their bodies turned inwards. So the actual definition is like consist of internal rotation and abduction of the arms with flexion of the elbows, wrists, and fingers. I would definitely look up pictures of these. Decort, I kind of think of like, it's like this, like they're hugging and stuff, like court, they go to their core, so they turn inwards. And then your next one is decerebrate. I can never say that one. But I think of it as like brat, like you want the brat away from you and their arms like turn outwards. Okay. Yeah, your decerebrate posture. So this one is more serious. And like I said, the position, the arms are stiffly extended, adducted, and hyperpronated. I would remember the definition of these. Your diagnostics, you can always just do like random things like your GCS, your CT, your MRI. But the one thing that's important for your diagnostics is you're always going to avoid a lumbar puncture.
Kêu ca kêu cười. Itu ikan kerja itu, ikan kerja itu.
You guys do this. Yes, cool. Right, I'm clearing this. So I'm gonna tell you, so a lumbar puncture, like I said, not performed when increased ICP is suspected. The reasoning that you can cause herniation, because you go in your lumbar puncture in the back, if you puncture it to pull the fluid out, the brain's gonna follow.
Burn out. Kay Tito.
The biggest med you guys need to know is mannitol. That one is your osmotic diuretic. This is just the one we give to decrease their ICP. I think that's all you need to know about mannitol. It's just an osmotic diuretic, and we give it for ICP. Some nursing things, you can keep their PEEP low. This is like, these are all things to like help not increase ICP, like so keeping your PEEP low, that's like your, like we mentioned earlier, your intrathoracic pressure. Keep the head midline. Keep your head midline, no flexion of the neck or hip. I'm going to monitor their ABGs. You can give seizure meds or precautions. So, you know, low stimulus, low lighting, quiet place. And then always just monitor their temp and try and fix their temp. You can use anything you can to fix their temp, medications, cooling blankets. But if you're using those things, try to avoid shivering, because shivering can also cause an increase in ICP. You can also give them hypertonic saline. And this one, it just produces like massive movement of water out of like swollen brain cells. Another option of medications. I don't think that one's more important. I think more the your mannitol is. And then your GCS, like I mentioned, your GCS can be used as one of your diagnostics. I think the other thing that's like important with this is you guys know less than 8 intubate. So if they have a score less than 8, you're going to need to intubate them.